To do today is show you how to make a sensory stick that I use all the time with my patients who have any kind of nerve injury. I have one made right here. It has moleskin on one side, a hook Velcro in the middle, and Coband on the other end. I put the hook Velcro in the middle because many times patients will pull this out of something and accidentally start using it, and it's much harder for them to start rubbing themselves with the hook Velcro versus one of the ends, which are pretty Coban and the moleskin are pretty easy and won't cause a lot of pain. So right here, what you do is you can just take some Coban and wrap at the end right here. And then on the other side, you'll take the moleskin and wrap that around. And then I just put on the Velcro. Oops. My Coban, sometimes it doesn't stick all the way. You just have to press it a couple times and it'll stick to itself most of the time. Right now it's not. And if that's a problem, you can always tuck it in, or you can use a piece of tape and they'll just use the other side. And so with this one, you also have the hook Velcro in the middle. So what I do is I tell my patient to use the moleskin, rubbing that lightly over wherever is sensitive. This, if it is a severe nerve injury or severe sensitivity, hypersensitivity, even moleskin will make their nerves feel like they're on fire. I have a patient that I just recently started doing this with, and she had a sagittal band extensor tendon repair. Both were repaired in her instance, and it was right over the nickel where the scar tissue was and where I suspect her digital nerve was kind of caught up in there, and she was having a lot of sensitivity. So I started her off with the moleskin, and even then it was making her almost physically ill. And so I told her to just try a couple of minutes at a time and then work up to about 5 to 10 minutes a day, twice a day, with her, with the moleskin. I gave her the whole stick though, because pretty quickly as your patients progress through the sensory integration process, it will get easier for them to deal with other stimuli. So this patient was having problems with even she was wearing a jacket that rubbed up against her hand, and it was making her whole hand feel like it was on fire. So with this, after 2 weeks, we've been working with it for 2 weeks. She's now actually able to do the Coban on her hand and tolerate the hook Velcro for a couple of minutes. Now, she still has some sensitivity, but it is getting a lot better. One advantage to this is all of this stuff is in your clinic. You're going to have this for splinting and a lot of time, and with wound care or edema. And a lot of times clinics don't want you to have to pay for stuff. Patients don't want to have to pay for things that we could give them for free, or, just provide for our patients because it's going to help them get better. So this costs nothing to us. So a lot of times I'll give them to them and they'll wear them out. The other advantage is they don't have to pay for anything that's expensive, and if they lose it or it falls apart, it's not a big deal. So you can always make them a new one. Now, usually my patients, they will wear this out and get to the point where they're doing the hook Velcro and everything's great. One other thing that you can use, that they can use in their household that they would have to help with sensitivity, is a terry cloth, any kind of washcloth or a towel that's kind of rough, or a sponge that is the scrubby side of the sponge. I always tell them to get new sponges so that they aren't using a gross one that's scrubbed pots and pans. All right, so that is all for making a sensory stick. I definitely encourage you to use them as much as you can in your clinic. Thanks.